Good day, my name is Reen Jan Sairi Argota from Davao Doctors College, BSN2 12G. And for today's assessment, I will be going to define, enumerate, discuss, and demonstrate about public nurse health bag. So to start, I would like to define the public health bag. So what is a public health nurse bag? So a PHNB is an essential and indispensable equipment for a public health nurses which we carries along with us when we goes out for home visiting. So what are the contents and the arrangement of this PHN bag? So first is I will be going to introduce to you all the equipments or the contents that are available inside of this bag. Paper lining, waist bag, plastic lining or lining, apron, hand towel, and soap in a dish. So the rectal and the oral thermometer, 2 pairs of scissors, so surgical scissors curve and surgical scissors straight. Next is the forceps straight and the forceps curve. Disposable syringe, hypodermic needles, sterile dressing, alcohol lamp, tape measure, cord clamp, surgical gloves or sterile gloves, cotton balls, mic or plaster, 70% alcohol, the ammonia solution, hydrogen peroxide, betadine, Zephyrin solution, and lastly we have the Benedict solution and the ophthalmic ointment. We also have our BP apparatus and our stethoscope. So all in all, these are the equipments that we are going to bring during our community health nursing or home visiting. After the equipments or the showing of the equipments, we are going to proceed to the arrangement of the contents inside this bag. So in front of the bag, left to right, here you can see the thermometer in case, the oral and rectal, the tape measure, the adhesive plaster, and the cotton applicator. So this is the cotton. These are the thermometers and tape measure. And so next is for the on the right rear of the bag, you can see the 2 test tubes inside and 1 holder, the medicine dropper, and also the alcohol lamp. So the alcohol lamp are inside in this is in the right rear of the bag. This is the on the left rear of the bag, you can see the medicine gloss, the baby scale there, the bandage scissor, and also the rubber suction. So for the back of the bag, left, right. So we're going to open the bag. So here you can see the 70% alcohol, the betadine, the hydrogen peroxide, the terramycin, the Benedict solution, the terramycin, the aromatic spirit ammonia, the Zephyria solution. And that's it. So in the center of the bag, you can find the 2 pairs of forceps, the curve and the straight. So this is the curved forceps and the straight forceps. And also you can also find here the sterile dressing. Here the sterile dressing, and also the cotton balls and the roller bandage. And it also contains the syringes, the 5 ml and the 3 ml, the hypodermic needles. These are the hypodermic needles, our kidney basin. So on the top pile, center of the bag, you can find the hand towel, the plastic bag, the soap in a dish, the apron, and the plastic lining here, plastic lining. For the packet of the bag, you can see here the surgical gloves and waste paper receptacle. Also, the folded paper lining is inserted between the flops and covered here at the side of the bag. And we also have our BP apparatus and stethoscope that are carried separately along with our bag. So the PHN bag should contain all the necessary supplies and equipments that can be used to support or to help a patient in a emergency needs. So the bag, its content should be clean as often as possible, and it should be sterile. And now we are going to place the bag in a flat surface or in a table, chair, floor that are protected with the paper lining clean side out, and put the bag's handles or strap beneath the bag. So now we are going to get our paper lining. We're going to open the bag and take the linen plastic linings, and we're going to spread over the work field area around the paper lining. We are going to take out our hand towel, soap dish containing soap, and we're going to place at the corner of the work area. So our soap dish, our hand towel, so we're going to put it here in the corner of the work area, and we are going to perform our hand washing procedure using our soap and water. We are going to open the bag, and we are going to get our apron and put it in the at the right side of our workplace, and we are going to put all the necessary articles needed in a specific care. So after we prepare all the equipments that are needed, we are going to proceed in performing the necessary nursing care and treatment. So after giving the treatment, we are going to clean and alcoholize all the things that we have used during our assessment, and then after that, we are going to proceed again with our hand washing procedure. So what are the rationale for this? So the rationale for that is we need to wash our hands before administering an assessment, so that we cannot contaminate any bacteria to our patient. And also, we need to wash our hands after the assessment, so that we cannot get any infections or microorganisms from those assessment or from those equipments that we have used, and also to remain our equipments to be clean and so after that, after we open our bag, we need to return all the things that we used during our assessment, and we need to return it in a proper place after cleaning, of course, after cleaning them. So the rationale for that is we can save our time and effort, and also to provide a clean So after that, again, we need to wash our hands, and then we need to clean and fold our plastic lining, place it in a bag, and we're gonna close without locking it or unpack it in the handles. So after assessing the patient, and also performing the public health nurse bag techniques, we're going to sit down and make a rapport with our patient. Because that would help us to gather information, observe, get the vital signs, and get a specific feedback after giving a treatment. And then we can also give a specific instruction to those patients na if ever nurses are not available during an emergency situation. Also, we can make an appointment again for the next visit, and we can take note for a lot of information and to gather data that we can use after the assessment. So after giving the patient's instructions and confirming any clarifications to the patient, we need to dispose those equipments that has been used and cannot be used again in a proper trash bin. And it is very important that we perform the sanitation immediately for us to be safe, and also for us to protect our environment from waste and garbage, and a lot of more. So, I have now done doing the assessment for the PHN bag. And again, my name is Ranjan Sairi Argota from BSN 2 12G. Have a good day, everyone. Goodbye!